Hello guys, welcome to our channel. And for today's video, we will be conducting a lecture, a requested lecture from the CWTS class of Ma'am Maria Ana L. Aquino, and I'm very much honored to be invited again for the third time already to talk about the same subject. So the only difference today is that I'm no longer be physically present to this event in the CWTS class as it was before. So with the new current setup that we have today, so we need to adapt with the changes. So I will be conducting my lecture on subject matter drug education in this manner. So thank you for inviting me to talk about this subject matter, and I do hope that in this lecture we will gain valuable knowledge relative to the topic that we will be talking about. Okay, so I would like to introduce myself first. I'm Mr. John Bel Galumba, and I'm serving as a faculty also of the College of Criminology in our beloved institution. I am tasked today to talk about drug education. I believe that this is a very important topic that the younger generation must have in relation to the current situation that we have today. We know for a fact that our current administration is really serious in targeting drug addiction, the drug problem in our country. As you can see that drug problem is much more complex than what we used to think of. In the field of criminology, we talk about criminality and peace and order all the time, and we do encounter a lot the connection of drug addiction to the increase of criminality in a certain area. So as far as observation is concerned, and a lot of study that was conducted in this topic, there is really a big relationship between criminality and the drug problem. And actually, in the current situation that we have, drug problem does not only affect those individual who are using it, and does not only affect the peace and order of a certain area, of a certain community, but um, it is much more complex, that it affects the economy, it affects the chances of survivability of a certain country when this drug problem is left unchecked. Before we proceed to our discussion with regards to drug education, let us first define the term drugs. So what is drugs as defined by some of the resources that we have? So drug refers to any chemical substance used as a medicine or in making medicines which affects the body and mind and have a potential for abuse. So basically, a lot of drugs that are available in our market, in our place, in our location, has usually a potential for abuse, or any drugs are actually have the potential to be abused depending on the user itself. So even an innocent drug can be abused, and when it is already being abused, that will now be considered as a dangerous or prohibited drugs. So there are tendencies that our innocent drugs that has the purpose only to cure, to alleviate illness and the basic function of a medicine, are being used for other purpose, mostly for a recreational purpose. That's the common motivation of drug abuse anyway, recreational purpose. So that is how we define drugs. So when we talk about drugs, these are substances that are used as medicine or used to create a medicine, and these substances has the potential for abuse. Now let's talk about the category of drugs. I would like to make a disclaimer. So, our concern actually in the field of criminology is to study the possibility or the effect of the drug problem, drug use, drug abuse to criminality. So I'm just going to mention the drug category. So we have here the prescriptive and over-the-counter drugs. So we have prescriptive drugs. What does it mean by the word prescriptive drugs? These are drugs that need a written authorization from a medical doctor before you can purchase those drugs. So we have a lot of medicine that would be categorized as that. These are those medicine that you cannot usually purchase in pharmacies without a written prescription. Why? Because of course they may pose danger to the consumer if they will be taken without any medical supervision. So it might affect them negatively, or you know they may produce drug problem. So those are classified as prescriptive drugs. They need a written prescription coming from a medical doctor before you can be able to purchase those in pharmacies or stores. Then we have the non-prescriptive drugs. That's the opposite of the prescriptive drugs. So when we talk about non-prescriptive drugs, these are also known as the over-the-counter drugs. So meaning these are the usual drugs that can be purchased into pharmacies without requiring any written prescription. So we have usually those drugs that cures simple ailments and so on. Those that does not need any medical checkup before taking, or drugs that are basically safe for consumption without the medical advice of the professionals. But I'm not saying that they should be consumed without any supervision, because as I've stated, anything that is abused, regardless of its nature, poses a potential harm to the consumer. So whether that is prescriptive drugs or non-prescriptive drugs, if it is abused, it will still have a negative effect to the consumer. So those are the two categories of drugs based on their medical purpose. And we have the term dose. For those medical students out there, you have probably encountered the term dose, but in our field, we only encounter the term dose when we are talking about drug addiction and so on. So just an overview with regards to the term dose. What does it mean by the term dosed? It refers to the amount of drug taken at a certain period. Now, why am I including this in our lecture? Because dose is one of the means why drug abuse occurs. So let's look into the 5 types of dose that I may connect it to drug abuse. So the first type of dose is what we call minimal dose. This is the smallest amount of drugs taken by one person in order to produce the therapeutic effect. So when we talk about therapeutic effect, the curing capacity of the medicine, minimal dose is the smallest amount that you're allowed to intake, that with that small amount it will already produce the positive effect, which is the therapeutic effect. So that's minimal dose. However, there are those individuals that have a higher tolerance to drugs, that minimal dose does not actually make any effect on them. For example, I'm having a headache as of now, then I take medicine, let's say 500 grams of a certain tablet of a medicine, but nothing changed, meaning I still have my headache. So after an hour, nothing changed, so I may take another tablet just to alleviate the pain that I am feeling right now. So they're just those types of people like me that the minimal dose does not produce the expected therapeutic effect from the drug taken, that I am taking another dose, or I'm increasing the dose that I'm taking just to produce the effect that I want. Usually that's for analgesic type of drugs. So if I'm having a toothache, I may be in pain right now, so I need to take a higher dosage of pain reliever in order to alleviate the pain that I'm feeling. So there are those things like that. But of course, it's not safe to self-experiment with regards to drugs, because drugs is like a double-edged sword that it can help you, but if taken without the supervision of an expert, a professional in that field, it may also pose an effect or negative effect towards you. But then minimal dose and maximum dose are still, I can say, still on the safe meter with regards to dosage. Now let's move on to toxic dose. So by mentioning the word toxic, and that I believe that may ring the bell already, that that type of dose is no longer safe for human being, because the untowards effects is already starting to manifest. So when you are already on a toxic dose, then there is already a negative or side effect that are occurring into your body. Then meaning that if those are occurring already, the side effects are occurring already, the dosage of that specific drugs or medicine is no longer on a safe meter. But there are those types of drugs that are being discovered, wherein people are going after the side effect that that consumption of drugs had produced. So that will now starts the path to drug addiction, drug abuse, wherein if they had experience already taking a toxic dose of that specific drugs or medicine, then they suddenly discover that the side effect is actually good. It makes them feel good. So they will now start abusing that drug. So have you imagined going beyond the maximum dose? There are those individuals that really want to experiments on drugs. They want to know, or they really want to know, how does taking not a large amount of drugs, how will it affect their functioning as a human being? I would like to mention the drug, the cough syrup that we have. Earlier, the cough syrup contains the substance called codeine. However, some individuals had tried overdosing themselves with cough syrup, and they discovered that overdosing themselves with such a substance will make them feel high at a certain point. So what did they do? They start abusing already that drugs, or they start taking a toxic amount of cough syrup in order to um, feel, or in order to gain the side effect that they wanted to have, which produces either the high or the feeling of euphoria that is produced by intoxicating themselves with such a substance. So those are the instances wherein the drug abuse is um being developed through experimentation and through intoxicating themselves with such such substances. Okay, now there are recorded deaths in relation to drug abuse. There are those individuals who died while they are taking already a large amount of that substance, and that large amount of substance that can produce death will, or is known as the lethal dose. Okay, so when you are already into using drugs, you cannot already limit yourself with the amount that you are consuming, because as frequent as you are using drugs, the tolerance level of your body is already increasing. So there is a tendency actually that the individuals who are using drugs may increase their uh, tolerance to that substance, which requires now uh, an increase also with regards to the dose that they are taking in order to develop the effect that they wanted to have, in order to feel the high that they wanted to feel. Okay, so that's the relevance of talking about dosage. Okay, so there's a risk, a health risk and psychological risk in overdosing yourself with drugs, as it may produce addiction or abuse. I would like also to mention the ways of how drugs are being administered. So we're going to talk about the administration of drugs. Usually, or majority of drugs can be taken orally. That's through oral ingestion. We have also injection with the use of syringe, and we have also through inhalation. Um, those medicine or substances that are in vapor form, those are taken through inhalation. Then we have also topical, meaning the substance or the drug is being applied to the outer layer of their skin. And we have snorting. I do not know any medical drugs that are consumed through snorting. I know that what I know is when we talk about the this means of consuming drugs, that is already an illegal drugs. Since when we talk about snorting, that has something to do with cocaine and any and other similar substance that are in powder form. Okay, so this is an administration of drugs also, but I do want to relate this to illegal drugs only. Then we have the buccal, wherein the drugs is being applied or being administered through the gums. And we have the suppositories, wherein the drugs is being administered to the anal orifice of the body. Okay, so those are the common way on how drugs is being administered to the body of human being. The next topic is we have the classification of drugs according to their medical purpose. We have analgesics. So when we talk about analgesics, these are the types of drugs that may alleviate pain. We have antibiotics. They are types of drugs that control or combat body infection. Then we have antipyretics, those drugs that may reduce the body temperature. Antihistamine, anti-allergy drugs. Contraceptives. These are types of drugs that prevent the meeting of the egg cell and sperm cell in order to prevent, pregnancy. Decongestants are types of drugs that makes the release of mucus easier, especially on your nose. And we have also expectorants that is for the release of the phlegm on your throat. Laxatives, it induces bowel movement. Sedatives and vitamins. Okay, so we're going to talk about also on the general classification of dangerous drugs. Our classification earlier was for medical purpose only, but now let's talk about the general classification of dangerous drug also. So we have at least made the three major classification of dangerous drugs. They are depressants, stimulants, and hallucinogens. So depressants are also considered as downer, as they induce or they reduce the functioning of the nervous system. Anyway, we're going to talk about this one by one. So when we talk about depressants, these are types of drugs that has a depressing effect to the central nervous system, meaning it decreases the functioning of the central nervous system, which slows down the brain activities and nerve activities. We have the classification, we have the examples of depressants that are commonly used by drug abusers. So we have barbiturates, tranquilizers, morphine, heroin, and codeine. I made mention of the codeine a while back. So depressants has that effect that it relaxes the body, the human body, and usually it induces sleep. So you might want to include alcohol also as one of the depressants that are commonly abused by substance consumers. Then we have also the stimulants. Okay, so when we talk about stimulants, these are the group of drugs that have the effect of stimulating the central nervous system. So depressants relaxes the nervous system. It slows down the functioning of the nervous system, while stimulants increases the activities of the central nervous system, which in return increases the alertness, it reduces hunger, and it provides a feeling of well-being or the euphoria that we are talking about. So generally, stimulants makes the user much much active compared to those who use depressant type of drugs. So we have the common dangerous drugs that can be classified as stimulants. We have here cocaine, amphetamines, even caffeine. That's the content of your energy drink, your coffee, chocolate drinks, and so on. So they contains caffeine. That's why you may notice that after consuming such beverage drinks, you have an increase, activities on your nervous system, which keeps you awake at night, or keeps you more energetic at the time that you consume those substances. So they contain caffeine. Then we have the illegal drug shabu and nicotine. Nicotine is also classified as stimulant. It is a substance that can be found on the tobacco, which makes tobacco addictive because of the nicotine content. This is equally dangerous as stimulants, the hallucinogens, or what we call the psychedelics. Hallucinogens has the major effect of altering your perceptions. It is a mind altering drugs. This produce hallucination or delusion that is same or pretty much dangerous, that usually causes the person to commit a crime because of this. They also distort the mood. They develop the false perception. They develop false thinking, false belief after the consumption of these drugs. So it's really dangerous to consume this type of drugs. So we have the common example for that. These are the marijuana. Then we have the LSD, or lysergic acid diethylamide, and we have the peyote, and we have the morning glory seed. Anyway, there are a lot more of there are many more dangerous drugs that can be considered as psychedelics, as they affect the mind, directly the mind of the person, that it alters their perception and belief of a certain thing. So they produces illusion and delusion. So they produce either illusion or delusion, which is very much dangerous, as we are talking about the behavior or the possible action of the person that he may take while he is under the influence of that drugs. So after talking about these classification or categories of dangerous drugs, we have already the idea on what are the different types of drugs. Now let's move on to the topic drug abuse. So what really is drug abuse? Drug abuse pertains to the use of drugs in such frequency that it causes physical or mental harm to the user, or it already impairs the social functioning of that person. So if you are already affected physically and mentally, that your way of living and the way you behave are already being affected, then we can consider that already as drug abuse. That's the nature of drug abuse. It impairs the physical aspect and mental aspect of a certain person. And also it affects how that person behaves socially. Okay? that he is already, instead of focusing to social activities or joining social activities, not anymore. He is already into the use of drugs, that all of his activities was already focused on drug consumption and drug procurement. How can we tell that a person is already a drug abuser? So we have here the signs or symptoms, the onset of drug addiction. So we can tell that a person is already become a drug addict when any or majority of these factors are already present, such as uncontrollable craving, meaning you can no longer control yourself to crave for more on that substance to which you are abusing. Let's say, for example, alcohol consumption. If you are agitated, irritated, or when you cannot consume alcohol, then we can say that you're already becoming an alcoholic. You are developing already addiction to alcohol. So if you feel irritated because of the absence of the substance, then that is already a sign that you are becoming addict to that specific substance. So that's just one. There's a lot more signs that we can look upon in order to determine whether that person is already becoming a drug addict. Another sign is we have tolerance. I made mention of the word tolerance a while ago. Tolerance refers to the tendency of the user to increase the dosage of the substance that he is taking, because our body literally develop tolerance over time. So the frequent you are consuming that substance, the lesser the potency of that drugs affects your body, which requires a higher dose of substance must be taken in order to maintain the effect that you are aftering at. So that's with regards to tolerance. If you notice that the amount of the substance that you are consuming is already increasing, you can say, or you can tell to yourself, okay, you are already becoming a drug addict or substance addict in a manner, whatever the substance you are taking. Then if it develops already physical dependence, wherein your body manifests changes when the substance is absent, that is already a sign that you are becoming a drug addict. Such as, for example, your hands are shaking when no alcohol was taken. Your body is sweating excessively. Your skin is itching when the substance is absent to your body. So those are already signs that you are becoming an addict to that specific substance. Then of course, psychological dependence, wherein you already think that you cannot survive without the substance, without the drugs that you're taking. Once you develop this kind of dependence, physical or psychological dependence, that is already a big warning that you are becoming an addict to that specific substance. Then lastly, we have the withdrawal syndrome. Withdrawal syndrome is a term that explains the sensation wherein the person who suddenly refused to take the substance to which he is addicted upon is feeling when the substance is being removed from his system. So let's say, for example, you suddenly stop drinking alcohol, you may develop the withdrawal syndrome, wherein headache, vomiting can be observed when the alcohol is absent. So the same true with regards to drug addiction, wherein most of the reason why those drug addicts cannot remove themselves from drug use is because they can not surpass the withdrawal syndrome, wherein the craving and the feeling of anxiety, depression, or stress that they are facing when the substance is absent is too much for them. That's why they cannot make it. And most of the time, they cannot make it. So if you are already a hardcore addict to a certain substance, it's really hard to surpass the withdrawal syndrome, or which causes a lot of substance addict to continue with their addiction because they cannot surpass the withdrawal effect of refraining to consume that specific drugs. Those are some of the signs, common signs that we can look upon when we want to identify whether we or another person is already becoming a drug addict. Now, you might want to ask how drug addiction is really acquired. There are a lot of reason on how drug addiction is usually acquired or developed. Sometimes it is through association. I believe this is the most reason why a person turns into drug addiction because as we can observe, there are only a few percentage of people who develop their addiction on their own decision. Usually they're influenced by other person or by groups, and that is what we call the peer pressure effect that makes them go or turn into addiction. If you are just discovering substances, taking substances all by yourself, there is no tendency that you will continue with your addiction. Usually, addiction is developed through association. That's the very big factor that we can mention with regards to the acquisition of drug addiction through association, usually peer pressure. There are also group of individuals who discover or develop drug addiction through experimentation. As we made mention, there may be some individuals who just, trying to consume drugs and they discover that, oh, okay, this will produce a good feeling, this will produce euphoria, this will produce a tripping effect, and so on. So they develop drug addiction through experimentation, especially during the early days wherein they do not really know the potential of that specific drugs, but they are already consuming it because of the effect. Then later on, they develop addiction. So we have a lot of history with regards to that. LSD, for example, was developed without knowing the potential harm that it may produce to human being. At the same time, heroin, morphine, those types of drugs are developed solely for the purpose of medical use, but then they were abused because maybe some people tried to experiment or tried to do something about these substances and had discovered the untowards effect of the of consuming that drug. So that is also one of the reason why drug addiction is being developed through experimentation. Next is we have through habituation. So when you're already into using drugs, when you tried already using drugs and you did not control yourself and develop habituation, meaning you constantly use that drugs. Let us say that you have a habit wherein during weekends you take or you consume one bottle of alcohol. That is already your habit every weekend. Later on, you will develop addiction to that substance because of habituation, meaning that habituating or the constant use of a certain substance may develop into addiction also. Let's say, for example, the consumption of coffee during morning, wherein you consume coffee every morning, that becomes your habit. Then later on, you discover that you are already feeling anxious when coffee is absent in that morning. So meaning the daily routine, your daily routine is affected. So you develop anxiety, you develop irritation. So that is a sign also of drug addiction. And we have the dependence, wherein we made mention of the two types of dependence, the physical and the psychological. If you depend on certain types of drug, either to help you on your daily activity, you can also develop drug addiction or addiction itself. Okay, so there are those individuals who allegedly cannot sleep without consuming liquor. Let us make them as an example. How did they develop that? That is actually developed through dependence. You know, a lot of people can actually sleep with a glass of milk, with a glass of water. But since they develop dependence on liquor to induce their sleep, then that will now produce addiction, wherein they cannot go to sleep or they cannot eat something without consuming that specific substance. So by that, the addiction was actually produced by themselves because they devoted or depend upon those substances to help them accomplish or do something about their daily activities. So that is true dependence, wherein people can develop addiction by depending upon those substances. Okay, so let's talk about the causation of drug abuse. Why drug abuse exists? So we have three major factors that will explain why drug abuse exists. So we have biological factors, we have family environment, then we have social factors. I believe these three are the major contributors to the increase of drug abuser in our country. So first, let's talk about the biological factors. So when we talk about biological factors, we are talking about the general health of that person and his motivation on consuming drugs. So when we talk about general health, there are those individuals who are suffering from medical problem that they really actually need to consume that drug. But then, uh, because of the prolonged consumption of that drugs, they will develop addiction. Then, after developing addiction, they will now tend to abuse drugs. So, let's say, for example, fatigue. You may use some sedative class of drugs. And since you constantly use that sedatives, then what will happen? You may develop addiction. Insomnia, for example, also is one, which requires a specific type of medicine in order to induce their sleep. And what type of drug is that? Depressant. So, by consuming those drugs over a long time, they will now discover, or their body will now start to develop dependence to those substances, which in turn will produce addiction to that person. So that's how it affects, or that is how the process of addiction, abuse in by just having a condition that actually requires this different type of drugs that can be legally prescribed. Let's talk about the individual's motivation. Individual's motivation refers to the reason why person uses drugs and why are they abusing drugs. So let's talk about them one by one. We have here true relaxation. Okay, so originally maybe the purpose of taking drugs was just to chill out, to relax themselves, but then later on, tolerance, habituation, dependence, then it resulted to drug addiction and drug abuse. Okay, then we have for stress relief. I believe they just have the same concept with regards to relaxation. Escapism, wherein they wanted to escape all away from their problems. That's why they consume liquor, they consume drugs, just to escape from the pressure of life. So that will also start the cycle of drug addiction, drug consumption, development of habituation, tolerance, and drug problem. And there are those individuals also, in order to increase their self-esteem, they use those substances. They're a shy type of people, but they wanted to develop self-esteem. They wanted to boost their self-esteem. That's why they rely on drugs. And another factor is we have the family environment. Family environment is a big factor also when it comes to drug abuse, such as, for example, the absence of father who will guide them and provide example for them, not how to behave properly. So if the father is absent, that usually affect also the growth of that individual. Overprotective or domineering mother. So if the king of the house is, you know, your mother, so how they grow their children is somewhat different also on how would a child normally grow when he is in a complete family raised by, you know, a strong father. Little do we know that actually the behavior of person relative to this is also affected through the type of family which that person was raised upon. So when we talk about the family environment, to summarize it all, it actually, or the reasons that we cited here, actually produces rebellion from the child, which sometimes cause the child to leave the family and seek for approval and care and love from the outside, wherein all of those negative or potential harm, risk taking behavior are all present in there. We have gangs, we have criminals, and we have bad influence that are just waiting for the child to go out and absorb all this bad seed that are in the environment. Okay, so if we're going to look upon them, like for example, broken home, criminality inside the family, drug use inside the family, how will these circumstances actually affect those persons living in that family? It will send them away. And when they're sent away, those danger outside are waiting to grab them and make them either criminal, drug abuser, or whatever the worst thing that you can think of. What about social factors? I believe social factors is worth mentioning also, because if the family fails to raise the child properly, to provide an environment that will develop a law-abiding children, what comes next is the social environment. Usually, if they leave the family environment, they will go to the to their neighborhood. They will go uh, to the social environment to look for possibilities that will help them, either make them or destroy them as a person. So what if in that environment we have a lot of drugs available, meaning everywhere you can buy drugs, you can consume drugs without worrying that you will be apprehended or so on. So what will happen? Well, a lot of people in that area will develop now drug abuse or drug addiction, because the social environment supports that problem. It tolerates those problems. So what will happen? Uh, it will make the area, it will make that place a chaotic area, and it will make that place an infested area in relation to drug abuse or drug addiction. Influence of the media. There are a lot of programs that, you know, why they prohibit already the um, display of tobacco, use of alcohol, use of drugs in uh, the mainstream media, shows, movies, and so on, because this affects actually the perception of the community and as well as those individuals in relation to drug problem. So we must initiate a zero tolerance with regards to drugs. We do not make an exemption to drug abuse. Drug abuse, whether in every aspect, is a problem. Social pressure, collapse of religious values, and laxity of the government in combating the drug problem. Gladly, in the current administration that we have under the presidency of His Excellency Rodrigo Roa Duterte, they are showing zero tolerance with regards to the drug problem. They are targeting drug as a major enemy. So that's good, because it shows that drug is really a problem, and they are not tolerating the consumption or use of drugs. So, in the last report of the Dangerous Drug Board that's under the PDEA, um, the drug problem in our country had decreased already because of the active policing initiated by the president to combat the drug problem in our country. So that's good. But if we are a country that tolerates drug use or drug abuse, such as other countries like we have, I'm not going to mention anything. So it will increase, or day by day the problem with regards to drug will continue to increase until the time that it is already beyond the control of the government or we as a citizen of that country. Now, what are the general effect of drug abuse? So it affects many aspects of the life of the abuser: physically, psychologically, socially, mentally, and economically. So when we talk about physically, malnutrition are usually the common result of drug addiction, because there's type of drugs that usually reduces the craving for food, and most of the drug abuser are no longer eating food. Their life completely revolves into drug procurement and drug consumption. So other than that, they don't care anymore. So usually it will produce malnutrition. Psychological effect, it will make them mentally invalid, which develop now their types of delusion wherein they have their own belief, that to which they believe that that is the ultimate truth. So they're already mentally invalid. They have a totally different perspective into what's going on, and that belief is usually wrong. Okay, but they do not see it that way. They believe that what they're telling, or what they believe in, is actually the truth. Like, for example, those who believe that, drug is not a problem. So they are already becoming a mentally invalid. If you believe already that, consuming drugs or consuming that substance is not actually a problem, you are already affected. You are already affected psychologically, that you are becoming a mental invalid person. Social effect, they don't have social life anymore. They socialize to those person who has the same vice as them. Mental effect, of course, a lot of person became insane, or they lose their rationality because of the drug consumption, because a lot of drugs actually affects the brain functioning of the person, and because of that, their sanity is also affected. Economically, does it produce them? Yes. Those drug abusers usually lose their job and their properties, because they usually sell, they don't have the job anymore to support their vice. So what are they going to do? They're going to sell their properties in exchange for drugs. And if all of those jobs, monies, properties are gone, what will be the option of that person? He will either engage into criminality such as selling drugs or committing crime. So that's the common way on how those drug dealers, or how those drug suppliers are getting people to sell their stuff. First, they make them drug addict. They supply they supply their needs with regards to drug consumption. But if that person can no longer pay for that substance, and he is already addicted to that substance, he will do anything just to secure the substance that he is addicted into. So they are now going to sell drugs despite the risk. They are now going to commit crime despite the risk, and despite the overwhelming penalty or punishment that committing crime will result into. They don't care anymore. So that is how drug use, drug addiction, drug abuse affects a certain person. Then lastly, I have the question for you. Do you still want to use drugs? That is the question that I want to ask to everyone, to every viewer of this lecture. Do you still want to use drug? Because if you will not use drugs, then I believe the purpose of this lecture is achieved. But after this lecture, you still want to use drug, then I guess I did nothing. I did not impact, I did not make any impact to you. Now, if you still want to use drug, let us talk about the penalty of using drugs. So we have here the penalty for drug use. This is just drug use, meaning you consume drugs and you were apprehended by the police officer. So what would be your penalty? So if you are a first-time offender, you will be forcefully subjected to 6-month rehabilitation. This is just drug use. No other offense was committed. Meaning when you were apprehended, you are positive for consuming drugs. No drugs was confiscated on your possession, because if there is a drugs that was confiscated on your possession, you will not be subjected to 6-month rehabilitation, but rather you will be imprisoned approximately for 12 years to life imprisonment, depending upon the quantity and the nature of the substance that was caught on your possession. Now, for second-time offender, drug use only, the penalty will be an imprisonment of 6 years to 12 years. So if you are imprisoned for that long, imagine how wasted your life had become. You only live for maybe 90 years old, and you wasted 1/4 of that time. You're lucky enough to live for 90 years. If you can, if you're living a healthy lifestyle, but approximately it usually falls under 60. That's the life expectancy, and you're willing to waste 1/2 or 1/4 of that life that you have sitting inside the jail, just because you cannot control yourself from using dangerous drugs. So if you're willing to take that risk, then go on. It's your life that you're destroying. But if you want to do meaningful things, if you have purpose in life, then avoid drugs. Okay? So do not destroy your life. And do not destroy the hope of your family and those person that loves you. Okay, so I guess that's it for my lecture with regards to drug education. I do hope that you learned something, and I do hope that I was able to give you an important lesson that can be used not only on your class but in your life also. Okay, so thank you for listening, and I do hope you enjoy the lecture. See you